Today's webinar, What's the Hype? JUUL electronic cigarettes popularity with youth and young adults, has generated intense interest. Over 2,000 people registered for the call, and we have 3 speakers with vital information to share about JUUL.
Okay. Today's webinar examines important new evidence of widespread awareness and use of JUUL by youth. We examine this evidence in the context of the implications these findings have for swift and effective regulatory responses to prevent youth initiation and the potential for addiction and harm to the developing brain. Presenters will share results of online survey research on youth awareness and use of JUUL, lab work on JUUL and other e-cigarettes confiscated from secondary school students, and challenges school officials are grappling with in response to the wildfire spread of JUUL used by students. JUUL represents a new breed of e-cigarettes that breaks loose from cigarette lookalikes. It is easy to hide and use without detection, and its flavors entice youth while delivering a very high and potent dose of nicotine to which unsuspecting youth can become quickly addicted. JUUL's cartridges, despite being sold as closed systems, can be opened and refilled with illicit substances, making use by youth even more concerning. JUUL's been all over the news this week with a letter from national public health leaders calling on the FDA to take immediate enforcement action and other regulatory steps to rein in JUUL, and the FDA announced stings of stores and online retailers to try to thwart sales to underage users and a new youth prevention initiative. We have an exceptional panel today that will ground our understanding of the need for effective regulatory action and enforcement. Our first presenter, Jeff Willett, is a vice president at the Truth Initiative Schroeder Institute, where he leads research on tobacco policy issues. Jeff has a rich history in public health research, evaluation, and administration, and is a recognized national leader in tobacco prevention and health disparities. We're pleased to have him present today on one of the first published studies to look at youth perceptions and use of JUUL using online survey data. Our second presenter, Erika Mansur, is the youth tobacco attorney and an assistant attorney general for the Arizona Office of the Attorney General, where she runs the state's youth tobacco inspections program. Erika's work with Arizona authorities to reduce tobacco sales to minors resulted in a nearly 30% reduction in sales. She will share important new findings from frontline work based on data collected from lab tests of JUUL and other e-cigarettes and e-liquids confiscated by school authorities, which will help inform regulatory and enforcement efforts. Our final presenter is Kimberly Homer Vagadori. Kimberly is the project director for the California Youth Advocacy Network. She has worked in tobacco control for 17 years and is an expert on youth and young adult advocacy and tobacco industry sponsorship issues. She will talk about JUUL Labs' efforts to pitch a JUUL-branded education campaign and reasons why California school officials, the public health community, and law enforcement officials have resisted. After the presentation, we'll field as many questions as possible. With that, I welcome Jeff Willett.
Susan, and good afternoon or good morning, everyone. I'm happy to share findings from 2 studies that the Truth Initiative conducted to better understand youth and young adult recognition, use, and perceptions of JUUL. I would just say we apologize for the audio during the early part of the call, and Susan was doing a great job kind of grounding the topic area and the detail, providing an overview of the issue, and we will be providing the detail regarding our findings and what is happening out there in the community. So again, if we could advance to the next slide, I just want to speak a little bit more about what JUUL is. And importantly, JUUL isn't your older brother's e-cigarette. It's not your typical e-cigarette. And there are a few distinguishing features. First, JUUL uses nicotine salts as opposed to what the industry calls free-base nicotine in its products. The company that developed JUUL believes that The nicotine salts deliver a higher nicotine yield than free-base nicotine. And it also not only has a very sleek and sophisticated looking design, but it also is designed in a way to really maximize nicotine delivery and to replicate a cigarette with regard to nicotine content. And that is a feature that the company really promotes, that JUUL Inc. really promotes. As Susan mentioned, there are a variety of flavor pods that are available, and importantly, every flavor pod sold by JUUL contains nicotine. So heading to the, there we go. And again, nicotine delivery is a key feature of this product. The figure there presents data from the company that developed JUUL, which illustrates how JUUL largely mirrors a traditional cigarette with regard to blood nicotine levels over time after the first puff. You see the pattern for the JUUL, for the blue area, is very similar to a cigarette, and see the data that JUUL provides for the average e-cigarette. So much closer to a traditional cigarette, and the 5% strength level of this product is one of the highest on the market for this type of product. So again, nicotine delivery is a key feature, and we're very concerned about use among youth and young adults who can experience negative health consequences and brain development from nicotine. As Susan mentioned, there's been tremendous market growth for JUUL. In March, JUUL represented 54.6% of the dollar share of the e-cigarette retail market. And this figure, the blue line, is JUUL. The other lines are competing e-cigarette products. And it just shows you the meteoric rise in JUUL and how it's taking over this market. JUUL came onto the market in 2015 and really started accelerating throughout 2017, and again now represents half the market share. Susan mentioned some actions this week. I think it's also important to mention that earlier this week the FDA requested information from JUUL Labs related to its marketing practices and research on the effects of its product design on public health. We were encouraged to see that request, but believe there is obviously much more that the FDA needs to do to ensure that we're regulating these products effectively. As you know, with the rapid emergence of a product onto the market, it's hard for kind of traditional public health systems to do rapid response surveillance. So we know how many kids are using these products. So the Truth Initiative deployed a couple of computer-based online surveys to get rapid response information on youth and young adult use, perceptions, and the terminology being used for these products. We just recently had a paper published in the journal Tobacco Control, which found that 25% of youth and young adults recognized JUUL, 10% had ever used a JUUL, and 8% had used JUUL in the past 30 days. A couple other really important findings. Use of the product was higher among males and for higher socioeconomic status young people. 25% of those who recognized JUUL referred to use of the product as JUULing. So the brand name itself is being used to describe use of the product. We believe that's a sign of really strong brand identification. And the majority of young people, even the majority of those who use JUUL, were not aware that JUUL pods always contain nicotine. That data, that information was from November, and given the continued increase in market share, we fielded a similar survey in April. And with the new survey, we actually lowered our age range to include 12 to 14-year-olds. So our April survey included over 1,000 12 to 17-year-olds, split roughly male and female, and the data that I'm about to present were collected during the first week of April, again when JUUL represented more than half of the market share. What we found that awareness and recognition of the product had increased from our November survey. So 38% of youth recognize the product. Of course, greater awareness may reflect increased attention from schools and in the media, but we did see an apparent increase in recognition. 18%, nearly 1 in 5 young people reported that they had seen JUUL used in their schools. And then with regard to use, again, this is a younger age range than we were asking in November. 6.5% of young people had ever used a JUUL, and 5.6% had used JUUL in the past 30 days. And as you go back and look at the slides, you can see the comparisons for 12 to 14 and 15 to 17-year-olds and comparisons between our new April survey and what we found back in November. We also were very curious about what youth are using in their JUUL devices. The pods come in a range of flavors, and presented here are the most popular flavors reported by youth. We asked those who used a JUUL flavor pod, which flavor did you use most recently? And the vast majority are using, they're using sweet or fruity flavored pods. You can see 4% said that they used a tobacco flavored pod, and roughly 76–75% were using fruit medley, mango, and cool mint. We also found that 30% of young people said that they had used marijuana or a cannabis oil with the JUUL device. As Susan mentioned, these products, while sold as closed systems, are able to be manipulated, and other substances are able to be used by the system. So concerned that 1/3 had used marijuana with JUUL. We were also very concerned about youth access to the products. So among those who were recent users who had used in the past 30 days, we asked them how they bought or obtained the JUUL device they'd used recently. And respondents could pick multiple responses because they may have used multiple JUUL devices. So these percents don't add up to 100% because more than one response was possible. The vast majority of youth reported that they obtained the JUUL device from a physical retail location. So the enforcement actions, the sting activities that the FDA took and reported on earlier this week are incredibly important for getting a handle on youth access to the product. We also found that youth are reporting that they obtained the products over the internet. And while internet wasn't the most common point of access, only 6% said that they obtained their device over the internet. We did find that youth who reported they tried to purchase online were successful nearly 90% of the time in actually obtaining the product. So we certainly need to close up online access points as well. We were interested in how youth perceive these products relative to cigarettes. Very concerned about youth who would now have never used a cigarette using JUUL, becoming addicted to nicotine or a similar product that's a nicotine delivery system, and transitioning to a cigarette. Cigarettes being the most effective nicotine delivery device out there, at least according to many people. So we wanted to understand perceptions relative to cigarettes. And 47% of young people said that that JUUL was a lot or a little less harmful than a traditional cigarette. So 47% perceive JUUL is less harmful than a cigarette. We also asked them about addiction, and 32% believe that JUUL is much or slightly more addictive than a cigarette. So there is certainly the perception and likely recognition among young people that there's a high addiction potential for JUUL. And again, this is relative to cigarettes. So concerning that young people have these perceptions, and we're concerned about how they are related to subsequent use of other products. So just in summary, for the sake of time, I'm not going to repeat the conclusions here. You can look back through the slides, but I just wanted to highlight a couple other things that, that we are doing to better understand this product and its public health impact. So we're looking at adult use of JUUL, including the extent to which adults may be using this product as a cessation aid. You can see this figure here. This is from our friends at the Health Media Co-Laboratory at the University of Chicago, which shows the tremendous increase in the number of tweets associated with JUUL. So we're supporting a range of social media studies looking at JUUL, Instagram, Reddit, and other social media platforms to better understand youth appeal and to understand the extent to which these products are being promoted in a way that is appealing to youth and targeting youth. And finally, we're examining the e-cigarette landscape. I mean, the entry of JUUL, this high nicotine delivery product, onto the into the e-cigarette category, certainly has the potential to really change the entire landscape, to shift that landscape to a much higher nicotine yield product, which then calls into question, prior studies that have examined impact on youth and may further raise concerns about the impact of these products on youth and potential transition to cigarettes and other products. So that, in a quick overview, is research from the Truth Initiative, and I'd like to turn it over to Erika Mansur now to present her work.
Thanks, Jeff. Hi, this is Erika Mansur. I am with the Arizona Office of the Attorney General, and I run our youth tobacco program here. And I'm kind of in a unique position in that I run our state's youth tobacco inspection program. So I actually work with the undercover youth that go out and test retailer compliance, make sure that they're not selling to minors. And then the other half of my job is really focusing on the big picture of preventing youth access and kind of all things public health with youth and tobacco products. So I'm going to kind of walk through the thought process of this work that we've been doing in Arizona related to e-cigarettes. And I don't know if I can advance slides here. Oh, there we go. Okay. So this is my disclaimer. As I mentioned, I work for the Attorney General's office. I'm going to present a lot of factual information from our work and findings, but any opinions that sneak out are purely mine and do not necessarily apply to my office or to the Attorney General. And also, I just wanted to mention, I know that there are a lot of educators on the phone today, and I want to particularly recognize you for joining us. Thank you so much for all that you do for our kids, but also for joining us here. You guys are really on the front lines of youth tobacco prevention, so I really, really appreciate your interest. Okay, so these are slides that pretty much everyone in the tobacco control community is familiar with. E-cigarette use, since they came on the market, has really just exploded, particularly in the past few years since like 2014, 2015, and now with JUUL on the market, and it's kind of just gone up from there. With the JUUL products, and I should clarify, JUUL has over 50% of the market, as Jeff was saying. There's a lot of products that are in this JUUL-like category. Obviously, other companies are recognizing how popular this particular format is. So there's a wide range of products that are now available. So when I'm mentioning JUUL, consider it shorthand for JUUL and products like JUUL, as described by Jeff. So this is kind of the big picture, e-cigarette use increasing, even as we're seeing some of the traditional tobacco product use decrease. And then this is the picture in Arizona. So similar to the rest of the nation, we're seeing increases in use, particularly throughout junior high school into high school. So this is an issue. And this is something that was really brought to our attention through schools and community partners. Well, okay, so we know that e-cigarette use is an issue nationwide. We know it's an issue in our state in Arizona. And then this Monitoring the Future study came out and said, look, only about 20% of high school students who are using e-cigarettes are using e-cigarettes with nicotine. So perhaps this isn't even the major concern. Maybe this is an issue of, this is a trendy new product, it's a blip on the radar, Kids are going to use it once or twice in an experimental context, and then they're just not going to continue. So there's only a little bit of nicotine. We don't have to worry. Calm down. So that was kind of this result that we were looking at, saying, okay, well, what do we need? What other information do we need to find out if this is really a problem that we need to be doing something about, or if it is going to be something that's more of a blip on the radar. So the issue with the study there is that it said only about 20% of the high school students who were using e-cigarettes knowingly were using nicotine. So knowingly is the key word, right? Knowingly has a very specific legal meaning of having actual knowledge. So then the question becomes, what's actually in this liquid that they're using? So, how do we know what the kids are actually using? This question was answered quite nicely for us when we had some outreach from our school resource officers that we work with. School resource officers initially in our Scottsdale school district reached out to us and said, hey, look, these products are a huge problem. What can we do? Is this something we can issue citations for? Yes or no? Should we be worried about this? What's in them? Lots of questions. And they had a drawer full of products that they had been confiscating from youth. So this is from both junior high schools and high schools. So down to 6th grade was the lowest grade level. And we collected, initially from Scottsdale, we collected about 100 different samples, and we brought them to our lab to test the nicotine content. This is an example of the kind of cross-section of products that we're getting. You can see there are some products that are the larger vaping devices, kind of over in the corner here. There's these JUUL type devices. You can see, kind of get a visual on the wide range of sleeves and decoration that some of these have. This is just to kind of give you an idea of what we're seeing. And these were our findings. We found that the samples that we collected tested positive for nicotine in over 90% of the products that were tested. Now keep in mind, these are products across the board. These are larger vaping devices, these are vials of e-liquid, these are pods, everything that this SROs are collecting, we tested it. So over 90% positive for nicotine. And of that 90%, we found 57% of these products had extremely high levels of nicotine. Now we were able to draw that line right about 44 milligrams per milliliter of nicotine. And they went up, I'll say the highest one that we found so far was up at 77 milligrams per milliliter of nicotine, which is extremely high, extremely dangerous. And these samples were all taken from products that looked like JUUL. It was this kind of little pod or cartridge type of design, as opposed to the larger vials and the larger vaping devices. The concern there is when you've got a product that could be life-threatening with as little as 60 milligrams, and you've got an item that's got about a milliliter in it at 77 milligrams per milliliter of nicotine, you have a potentially lethal dose in something that's as small as about 1/3 of a teaspoon. So I'm going to really briefly run through our testing methodology at the lab. I apologize to the scientists out there. I'm not going to get into the weeds on our methodology, but I'm just going to let you know how we were able to accomplish this. We worked through our state health department's lab, and we did not go through the crime lab, which I know some other states have kind of worked on that before, mainly because trying to get on the waiting list, so to speak, for the crime lab is a huge challenge for us here. So we were able to do this much more efficiently going through the state health department lab. And we specifically went through this food emergency response network. Nicotine is a toxin, so this is something that they were able to test for. And this is done in conjunction with the FDA, and the FDA had full knowledge that this is what they were doing and was okay with this particular use of it. So again, this is for the scientists in the crowd. This is just going through some of our methodology, which, as I said, I'm going to click through a little bit, but the limit of detection is extremely low. So we can find very, very small levels of nicotine. This was not an issue in the samples that we were testing because the vast majority of the samples had 1, 2, 3, 4, 5% of nicotine. Let's see. So anywhere from 1 to 5% is where we were finding, with the vast majority being over 4%. One of the issues that our lab actually had was that because these concentrations were a lot higher than we were initially anticipating, they really had to dilute down the samples. So that was a challenge that your labs may run across. They were able to very creatively reuse some of their equipment that they had. There's actually a strong similarity between the chemical melamine and nicotine, so they were able to use setups that they had for testing for melamine to use for nicotine. So that might be helpful for your labs as well. So the samples only took about 10 minutes to run, which is something that I get questions on quite a bit. It is, according to my lab guys, it is a relatively quick and easy test to run and relatively inexpensive as well. These particular tests were actually run under the FERN, so it was under an existing federal grant. So it was actually did not incur any additional costs for the state, which is fantastic. And the schools loved hearing that we could test this and it would be at no cost to the school. So there are a few lessons that our lab guys wanted to pass along. First of all, the e-liquid cartridges leaked. And you have to keep in mind that nicotine is a hazardous substance. It's very dangerous, and it can be absorbed through your skin. It is also considered a hazardous waste under RCRA, so disposal of these products has to be done in an appropriate manner. And handling these products can be a little tricky. So as we're testing these products, we really found out, like I said, JUUL and similar products were by far the product that's confiscated the most. Our most recent testing, I actually just got the test results back last night. We found that 95% of our products that we tested positive for nicotine. 79% of this last batch actually had the high levels of nicotine. And of that 79%, all of them were JUUL or JUUL type devices. I really wanted to include this picture. This is something that is somewhat popular on social media. It is a student who is using a JUUL product in class. The gentleman sitting at the desk in front of the computer is the teacher. So this is something that's a challenge called JUUL in School. There's all kinds of examples of videos like this on the internet. But I post this particularly because I've heard a challenge from certain schools when we approach them and ask them if they'd like to participate in this program and provide us with devices that they've confiscated. In some schools, I get the message back, "Oh, this isn't a problem in our school. We don't have these in our school." And unfortunately, what I'm finding from the students and parents is that they really are in nearly every school. I have not spoken with one junior high or high school and had it turn out that actually not one person in the entire school was using the products. I was just at a school not too long ago, and that was kind of the message that the parents were going toward is, well, surely this isn't a problem in our school. And one of the parents stood up and said, "I have a 6th grader and a 9th grader, and I can tell you that these products are in our school, they're being used in our school building on a daily basis." So pictures like this can be really powerful if you're trying to talk to your administration and let them know that you really do think that this could be a problem. Also, we've got Cookie Monster. There's a lot of memes being created and things like that with really, really strong youth appeal. So speaking kind of along the social media lines as well, nicotine poisoning and addiction, this is something either that could go unrecognized or even becomes almost a joke. One of my favorite quotes is up here. This is from a student who's a JUUL user. It talks about, "It's not like I'm constantly feeling like I have to do it, but I probably go to the bathroom once every two hours or so to use a JUUL." That sounds a lot like a pattern of addiction, choosing to use a substance about every 2 hours. But they don't always identify that as addiction. Down here in the bottom, you can also see 2 days he went without. It was all he could think about. Again, symptoms of addiction. Some of these other things, talking about feeling nauseous, talking about feeling lightheaded or dizzy, these are all symptoms of nicotine poisoning. And I've actually received reports, I've had a couple of reports from schools in Arizona and reports from other states in the nation of numerous instances of nicotine poisoning. Some of them linked specifically to JUUL and similar products or other e-cigarette products, including symptoms like vomiting, in some cases even cardiac arrest, convulsions. So there's a lot of work to do as far as awareness and having this nicotine poisoning training. So kind of in our phase 2 of where we're going next, I'm going to be doing a presentation at the Arizona School Resource Officer Association at their annual conference trying to do kind of a statewide outreach and say, look, send all of your products to me. We want to get as big of an idea as possible of the scope of this issue around our state. We have had some really good luck working with our fantastic county partners. And we've had schools, up in northern Arizona. We've had schools over by the California border. We've had southern Arizona sending us in these products. We're really getting a good idea that these products are scattered in, urban communities, rural communities, small towns, all over, all different SES. And then we've been working on collaborations with our health department, with our Department of Education, our school resource officers. We really want to get some basic safety information out there for school resource officers and school nurses. School nurses, we certainly want to make sure that they're aware of the symptoms of nicotine poisoning and the various things they can do to treat it. And for our school resource officers, a fundamental issue is just educating them on the dangers of nicotine and the various ways that they can get exposed, particularly from direct exposure to their skin. I think there tends to be a lack of awareness there, particularly among the students, but even with our resource officers, that if they've got a cartridge or a pod or a device that's leaking liquid and they just pick that up with their bare hands, that they can wind up getting exposed to nicotine. And that's another way that students could inadvertently become exposed to nicotine as well. So with that, I'm happy to answer questions at the Q&A section or later on. I know TCLC is going to be helping us out with that, and I will pass it on to Kim.
Great, thank you so much, Erika. So my name again is Kim Homer-Vagadori, and I am with the California Youth Advocacy Network. We are a statewide organization based in Sacramento, California that's funded by our California Tobacco Control Program. And we are funded to provide support to our local agencies that are working with youth and young adults on tobacco control issues. We also work directly with our college campuses in California to adopt, implement, and enforce 100% smoke and tobacco-free policies. And then we also work with military populations, our military installations, and veterans throughout California to make sure that they're getting the support they need in quitting tobacco. So because of our work at the statewide level, we have a lot of really great relationships with some of our state partners. And because, again, of our work with the populations, with youth and young adult populations, we also do a lot of work specifically with emerging products, which is how we got involved in JUULs. Okay. And I'm not able to change this slide. There we go. So we started working specifically and looking specifically at JUULs in early 2017. And the reason that this came on our radar, again, we really are trying to track what products young people are using, recognizing that youth and young adults, I would say nationally, but specifically in California also, are really the ones to start seeing these products first. So in early 2017, our office started to get calls from schools, mostly in the Bay Area, who had contacted us to ask questions about JUULs. They were seeing JUUL use in their bathrooms, they were seeing them on school campus, and they wanted to know what the product was. So we started to look and to ask questions of the young people that we work with to find out what the product was and where they were seeing them. One way that we did this was we conduct focus groups. We conduct focus groups every spring with high school aged youth and with college aged young adults. And so this last year, we went out and did focus groups across the state with youth specifically. We have youth specific groups and then young adult specific groups. And we asked those young people just questions about the products that they're aware of, what they're seeing. And then if they're willing, we asked them questions about what they're using. So in this last round of focus groups we did them in 4 different counties in California, recognizing that the counties that we were in are mostly urban. So in the last round, we didn't do many rural focus groups. And our total participants were 78 youth, and these are all high school aged youth, and then 73 young adults. There's a star next to young adults because this previous year, we did do a group specific to high-risk young adults who have recently been incarcerated or in the foster care system. When we do our focus groups, we show young people the products that we are talking about. We show them on a screen. We do not actually bring the products with us. And we ask them what they call these products. We really want to be aware to the fact that in public health, often we use terminology that may be different from young people. And so we asked them, we showed them different products, and we just asked them what they thought about the products, what they called the products, what they have heard about the products, what friends they had that were using the products or others they know using the products, and then to tell us a little bit more about those individuals. We also just are asking them anything else they're willing to tell us about these products. Last year, because of a lot of the questions we started to get from our partners at schools about JUULs, we decided to add in a JUUL device into our focus groups. And so these are all of the different products that we shared specific to vaping devices. We also did a couple of other products, and because California recently legalized marijuana, there were some questions specific to blunt use, because marijuana was a topic that came up in every one of our focus groups. So what we found last spring was that there was some awareness around JUULs. What young people told us was they thought they were pretty cheap compared to other products they were using. We found this to be more so with our college population, and that's because a lot of the college students we talked to were also using mods, which they found to be more expensive because they had to buy all the different parts to it and also the vape juice. They said that they liked the idea that you don't have to constantly be buying a whole new thing every time you want to use them. They felt they were super discreet and easy to hide, so they could use them in places that were smoke and tobacco free, which in California, all of our K through 12 schools are 100% smoke and tobacco free, and all of our four-year universities are also 100% smoke and tobacco free. We also had a number of people comment on how strong they were, how they felt it was a very different hit once they took it than with other vaping devices. And they liked that the vapor was subtle and smooth, that it wasn't a thick smoke. So we started to notice these observations, and we continued along with the work that we were doing trying to do prevention. But we didn't focus too much on JUULs until in the fall in 2017, our office received a call from a JUUL lobbyist in California who asked if we would be willing to partner with the company to do youth prevention. Our team has actually done a lot of work with universities on tobacco industry funding of academic research and are well versed on the history of youth prevention programs funded by tobacco companies. And so, of course, when we got this call, we were very weary of it. And this immediately raised a red flag for us. And so out of this, we developed a partnership with our Office of Attorney General here in California and started having conversations about how can we find out what's happening with JUUL use, specifically in our schools, and decided to put together a survey to identify what was happening, who was using these products, what was being confiscated. We were also looking at flavors of products that were being confiscated. And so CYN and our Office of Attorney General and our Department of Education and our California Tobacco Control Program came together to put together a survey that we were then going to send out to our tobacco use prevention and education partners that were at every county here in California. So while we were putting together that survey, we were notified by partners in other states who let us know that they had heard from some of their school partners that JUUL had reached out to them about doing a youth prevention program. So when we had heard of this, we had directly connected with our Department of Education and also with our AG office to just get the conversation going to find out what was going on. And at that point, things started to move very, very quickly. We had learned that not only was JUUL also doing outreach to schools here in California, that the individuals who were working on behalf of JUUL to do this outreach were actually from California. It was a former superintendent of one of the districts here in our state. And so we were very, very quick to connect directly with many of our state agencies to try to get out into the schools to let them know that this was coming up. And then we also incorporated questions into the survey we were sending out to find out what schools in our community have been contacted by JUUL. One thing that was also of interest to us that we really tried to do was collect as much information as we could from the schools who had been contacted by JUUL to see what they were planning on doing. And then we also wanted to work with our Department of Education. What we had found was our superintendent of education had been contacted by JUUL, and they had given them the strategy for how they were planning on doing youth prevention in schools. So based on this communication with our Department of Education, what we learned is JUUL's strategy directly was they wanted to work directly with schools to find out what the problem was. They had actually given us a list of targeted schools that they were planning on doing outreach with. They have plans to work directly with law enforcement and with school leaders. And we also know this again from other outreach and correspondence that they had done directly with districts and schools in California. And then they also wanted to have focus groups with youth to find out more about prevention strategies. Additionally, they had proposed to create an alternative youth prevention program that could be incorporated into schools. And the idea is that instead of suspending students, that students who were caught using JUULs or other products could then go through this prevention program called a Saturday school. And what this would do is it would reduce suspension rates. Now, we've met with some officers from our schools who said that this is a fantastic strategy for JUUL to consider because there's a lot of pressure for schools to reduce their suspension rates. So this sounds like a really intriguing opportunity for schools to take on. We also found that JUUL is looking at not only partnering with schools, but also partnering with organizations such as the National School Boards Conference, which there's a conference this month, and I'm not sure if they attended or not, but in the correspondence with our Department of Education had said that they were planning on attending there. And then they also have had a plan to develop technological solutions to prevent young people from using the device on campus. So what this looks like based on what they gave us was that they were creating a Saturday school that had two components. One component was directly for high school students, and the second component was for parents. And instead of suspending students, they would go through this prevention curriculum. And for the students, it was a 3-session, 1 hour per session curriculum that was focused on nicotine addiction and marijuana specifically. And then there would be 1 session for parents. A secondary component of it was that they were proposing to put these nodes on campuses that would essentially jam a JUUL device if a young person was using it on a K-12 property. We've heard some concerns from schools that this would be a big issue with student privacy and collecting data on young people. Once we had heard of all of this information, our team again worked with our state agency partners to work very, very quickly to reach out to all of the coordinators working at the county offices of education as well directly as with schools to let them know about JUUL's outreach. We also, in California, any agency that has funding through our tobacco tax dollars, which many of our schools currently do, the Department of Education reminded them that they are not allowed to partner with tobacco companies. Our state definition of tobacco is very comprehensive and also includes vaping devices. So these companies would also fall under that language. So they were not able to partner with JUUL to do any of their prevention programming. We also thought it was very critical to make sure that if we were telling our school partners they cannot use this prevention program that JUUL was putting out there, that we gave them a prevention toolkit, which I'll talk about in a moment. After this initial email was sent out very quickly, we sent out a secondary email that the Department of Education sent out in partnership with us in our AG's office, requesting that they complete the survey to give us more perspective on the problem of JUUL use within schools, and then also to let us know if JUUL had been in contact with their schools so we could track which districts and specifically which counties in California JUUL was reaching out to. And again, JUUL had given the Department of Education a list of the districts they were planning on connecting with and working with on their prevention program, and we wanted to see if this list was consistent with the schools who had actually been contacted. In addition to this, our team also did a lot of outreach to the tobacco control programs at the community level to let them know all of this was happening and to encourage them to work directly with their schools and to make sure that they were aware of these products and aware that JUUL was reaching out to the schools and to let them know that these partnerships are against the best interest of the work that we're doing in tobacco control in California. So as I mentioned, when we were aware that JUUL was reaching to schools, we have partners at Stanford who have a tobacco prevention toolkit online. And they worked very quickly to finalize their JUUL curriculum that they had been working on and to get that ready for us to send out to all of the counties in California, all of the offices of education, so that we could make sure that our educators here in California had a curriculum specific to JUULs that they could immediately get out to students in K-12 schools. So this is a great toolkit. It was funded by our Tobacco-Related Disease Research Program and our Department of Education, and now receives funding from CVS Health Foundation. And this was a great tool for us, again, to push out to all of our offices of education to let them know that they really need to not partner with JUUL and instead to implement this tobacco toolkit from Stanford, who is a partner in tobacco prevention and control in California. And so with all of this in mind, we have been continuing to have these statewide partnerships with our AG's office, Department of Education, our Department of Public Health. We also have amazing partners at the national level. We've been doing work with the Campaign for Tobacco-Free Kids. We have partners in Massachusetts and Wisconsin that we've been working with to really just try to track what is going on and make sure that JUUL is not continuing to try to connect with our schools. We do know we were able to learn that JUUL has reached beyond the schools and have actually tried to, or successfully has partnered with a community-based youth organization that also works with law enforcement in California. So we're collectively working with our local partners to identify what that partnership looks like. And it's also an opportunity for us to do more outreach to community organizations and let them know that there are other prevention materials and opportunities to make sure that young people aren't using these products. In addition to the survey that we sent out in February to all the TUPE, or the Tobacco Use Prevention and Education programs, we're sending out a secondary survey within the coming weeks where we're trying to get information directly from school administrators and school resource officers to identify what the problem is and to find out what products are being used. So we're really looking forward to trying to collect that information. And again, we're also looking geographically to see where the problem exists in California, because it is a very diverse state, and we always like to see if this is an issue in certain populations, rural versus urban, etc. Our team is just now starting our spring focus groups with youth and young adults. So we, again, are going throughout California and asking questions with young people about the products that they are aware of and their knowledge and their use. And so while JUUL will be included, it's not the only product that we will be covering in these discussions with young people. And then we're also working very quickly to put together some prevention materials to let young people know that this is still a vaping device, to inform them of the high levels of nicotine and provide additional information with the hope that we can discourage use. We also, whenever we do any of our prevention work, we encourage people to quit using tobacco altogether and not to switch to other products they may feel are safer. And so we are continuing this work. We also do a lot of outreach to our adult partners and just try to build the capacity of all of the communities in California to make sure they're using best practices when trying to prevent youth addiction and help people quit tobacco. We are definitely aware of the prevention program that JUUL announced yesterday. And while we know that they, in this proposal, have stated that they plan on working with some tobacco control partners to decrease use, we have a very strong stance on this and feel that their prevention program is still inconsistent with the work that we are doing, trying to remove tobacco products from our communities and help people quit using tobacco with the best practices that we have available for us. So I'm happy to share any additional information. These are some of the myth and reality cards that we have, and we'll have a new one coming out with some of the newer vaping devices within the next couple of months. All of this information can be found on our websites. We have various websites for the different populations that we work with, but I'm happy to share any of this as well as any of the information from the surveys that we have previously collected, as well as the surveys that we plan to be collecting in the weeks to come. Thank you so much. Now back to you, Susan.
Thank you for the important work that each of you is doing and for presenting on your work today to help inform the work of others. We encourage listeners to check out these resources on this slide. And also please note that the slides and the recording of this webinar will be emailed to all of you who attended the webinar, hopefully tomorrow. The link to our new fact sheet on JUUL, which is listed at the top of the resource page, will also be available tomorrow. Now for questions, the first of which is for Jeff. With regard to truth research, Jeff, can you say more about how you recruited your sample, where it was recruited from, the sample size, the location, the age range?
Panel of individuals who participate in online survey research. So access to the youth through that panel. We obtained parental consent to speak with the young people. So all of our survey results would have started with an adult in a household who then provided consent for a youth, a young person in the household to participate. The sample size was 1,025, which was pretty evenly split between a 12 and 14-year-old group and a 15 to 17-year-old group. I didn't present data for regions, but our sample included youth from all regions of the United States and was evenly split between males and females. The slides do present the percent for race and ethnicity and percent from different socioeconomic levels. So you can review the slides for that information. But I mean, obviously with survey research, you are talking to a sample of individuals, collecting data, and then doing analyses to estimate what attitudes, knowledge, beliefs, behaviors may be at the population level. So we used those methods with our sampling, data collection, and analysis.
Thank you, Jeff. The next question is for Erika. Erika, did any of the confiscated pods contain THC or other illicit substances?
So this is actually a question that I get fairly frequently. We do not test for illicit substances, largely because the products that we're collecting, as I mentioned, are confiscated by school resource officers. So if the individual school resource officer suspects that the e-liquid contains an illicit substance, the e-liquid will actually test positive on a field test. So that's, you just picture, cotton swab, dip it in the liquid, and then they have a little test, and the liquid turns a different color depending on what the substance is. So my understanding from the school resource officers that I work with is that they'll test for THC, and then that goes on a different path than the nicotine or suspected nicotine ones that they send out. But I have had numerous reports from school resource officers of positively identifying THC in e-liquid devices.
Thank you, Erika. The next question is for both you and Kim. We received questions about whether you'll be publishing the results of your research.
I'll go first since I think I've got the unmute at the moment. We don't intend to, and the main reason, we might be publishing it in a kind of an informal way, not as a research study per se, largely because we're receiving these products from school resource officers. Often they're in a Ziploc bag in a drawer. So as far as the rigor of the exact content of each pod, I think there could be some questions there. We're really looking at it more as information gathering to inform our law enforcement efforts. But we do have some data that we collect from sealed packages as well that we confiscate. So I think there's a potential for it, but we just have to overcome those issues.
And we're the same from the California Youth Advocacy Network. All of the outreach that we do and the conversations that we have with young people, we use simply to strengthen the work that we're doing. So as a training and technical assistance provider, we use all of our findings to then go out and better inform the populations that we work with in California to make sure that the terminology that they're using, the prevention materials that they're using when they're speaking to young people about all of these new products and devices is consistent with the language that they're using. So it's really just to inform our work and to inform the materials that we create so we don't publish that. With that said, we do write reports of all of our findings from the focus groups each year, and we're happy to share those with people who are interested in them. You can contact me directly for that, or we're in the process of building a new website. So once we have that site up, we'll be putting all of our reports on that.
Thank you. That's all we have time for today by way of questions, but we will be forwarding questions to presenters and we'll do our best to respond offline. You'll receive a survey via email tomorrow, along with information about the follow-up webinar on regulating JUUL and other e-cigarettes, scheduled for June 15th from noon to 1 Central Time. Please let us know what you think, and thank you again for attending today's webinar. Goodbye.